Welcome. Thank you for coming today. Look forward to speaking with you about Lyme and tick-borne disease, specifically regarding prevention. So let's get started. I have a Q&A up, so I'd love to hear from you. Are you seeing some ticks this season? Depending on where you are in the world, especially if you're on the East Coast, the Northeast United States, we do see a lot of adult black-legged ticks out there right now. So we can talk about some prevention strategies. But first, maybe a little bit about me. I am a naturopathic physician and acupuncturist. I've been working with people who have Lyme and tick-borne disease for about 13 or 14 years now. So I work both with people who have active cases, and I also do a lot of education to the lay people as well as other professionals regarding Lyme and tick-borne disease on the topics of prevention, diagnosis, and treatment. So I'm really glad you're here today and that we can talk a little bit about some top tips for preventing tick bites in the first place. I really became interested in this topic because a friend of mine, while in medical school, came down with what we then determined was Lyme disease. And I unfortunately saw that navigation of symptoms and going through testing and then the treatment. So an otherwise young person who had really a hard time with some really difficult symptoms. So then I became interested in it more professionally as well. So then through treating patients over time, I kept seeing, unfortunately, how some people are really apt to get tick bites. I was in Vermont seeing people in person at a clinic there that I still work at, Sojourn's Community Health Clinic, and seeing a lot of farmers and loggers, and people just love being outside. It's a beautiful place. And so they would get tick bites, and we might determine there was a tick-borne disease, go through that treatment, watch them get better, which was so wonderful. And then sometimes they would come back with another tick bite. So I really wanted to start equipping people with some real serious strategies so that they could stop getting those tick bites and stop getting Lyme and tick-borne disease, right? Because even if you have had Lyme or tick-borne disease in the past, it doesn't mean that you're not going to get it again. So after going through all that hard work, time, effort, life changes that can occur when somebody has Lyme or tick-borne disease, to get it again can be devastating. So let's see. How's it going with the Q&A? Any answers there? Who's seeing ticks this season? And then wondering, is anybody doing tick checks? That can be the first line strategy against getting Lyme and tick-borne disease. So let's see if we can get that question up there. Thanks for joining today. We're going to give a little more time for people to show up as well, but let's get another poll out there. If you're able to answer some questions, please drop in the chat where you're from so I can also think about that, because there are different ticks in the different areas of the country and the world. So it helps me know who I'm speaking with and what kind of risk you're at. But let's go right into some nice tips. So I talked about tick checks. Ticks love moist, dark areas. So when we're thinking of tick checks, it's really important to think about that. So when we think about the habitat of ticks and landscape, we think about that, and we'll talk about that. But on the tick check, we're also thinking about places that are hard to reach. So underarms, under the waist, belt, behind the knees, different places like that where it might be darker, moister places ticks love to be. And so also you can put your clothes in the dryer for 6 minutes. So when you come in and you're doing that tick check, I recommend throwing your clothes right into the dryer, directly into the dryer. 6 for ticks is the saying, and that will kill ticks. If you put them into the washer first, that moisture, like we're talking about, they love that. They're going to survive unless it's very, very high heat. If it's very hot water, they might not make it through, but usually they're going to make it through that wash. And then you might have ticks in your washer, right? So we want to avoid that and go straight into the dryer. 6 minutes on high will kill the ticks. If you do go to the washer first, because of course that's more intuitive, and want to get your clothes clean, you do have to put the clothes then into the dryer for an hour, 60 minutes. So please note that on high, and that will kill the ticks. All right, so let's talk about some other things that you can do to protect yourself against tick bites. So another strategy is thinking about tick repellents. You know, how can we go out into the world, enjoy being out in this beautiful autumn weather and not get tick bites? So there are many options. I happen to really like Tick Shield. I see that it works very well. It's by a company called Cedarside. It uses cedar oil. And actually, there was just a study last year showing that the Tick Shield cedar essential oil spray was just as effective as DEET. So for those of you who may be looking for a more natural option, I definitely recommend Tick Shield. The thing is, the study also showed that both Tick Shield and DEET only last about 1 to 2 hours regarding their power against ticks. So we want that repellent to last as long as possible. So you do need to keep thinking about that and reapplying, which takes some effort and some management there. So every 1 to 2 hours, whether you use DEET or you use Tick Shield, really important to reapply to the skin. And the great thing about Cedarside is that it's safe, completely safe for the skin. So thinking about going out, enjoying the outdoors. Some people might also work outside. You know, some people might be farmers or loggers or gardeners. So for you, you have an extra risk, and probably remembering to do that reapplication every 1 to 2 hours is going to be pretty tough. So I would recommend adding permethrin. So permethrin, not to our skin, but using permethrin on our socks and shoes decreases the chances of tick bites by 73 times. So that's pretty amazing. So just focusing on the socks and shoes will really decrease your chances of a tick bite. Now, this is something you can do on your own at home. You can buy permethrin. One brand that I use is Sawyer's, 0.5%, and you spray it right onto your socks and shoes. Now, do this outside. We want to be safe with the permethrin because permethrin is toxic to our skin. Now, just as a side note, it is used medically as a treatment for scabies. So it's not like it's never used on the skin. Sometimes it's actually really important. But we want to otherwise really be careful with our skin using permethrin. So I recommend using gloves and going outside, taking all the shoes, the boots, sneakers, spray them down, soak them up, and put them in the sun. And in about an hour or two, they will be dry. And then you can bring them back in. So when it's dried into that material, it is no longer harmful for us to touch. And you can have kids around it, dogs, pets. It's okay for all of that once it's dried into the material. When you are spraying it, when you're using it, if you're picking up those shoes while they're wet, please keep them away from your skin and others. The treatment lasts 6 weeks. So what I do is I put it on the schedule. I have it on my calendar. And then every 6 weeks, I will remember to bring all the shoes out, spray them down, and have that ongoing during tick season. right? So thinking about tick season, what is tick season? So anytime it's above 28 degrees Fahrenheit, is tick season. The ticks can be active during that time. So in the northeastern United States, sometimes we get a break during the winter, which is really nice. But sometimes we're having those warm days during the winter, and the ticks can pop out. And I do see tick bites during the winter. Of course, fewer, but it still happens. So just to keep that in mind. So I'd keep that rolling, that 6-week calendar rolling for the permethrin treatment of socks and shoes. You can also get socks from a place called Insect Shield. They actually make socks, or you can send your socks to them. So if we're going to just focus on socks and shoes, you could actually get some socks, and then they look different. They're from Insect Shield, so you can keep track. Hey, these are my permethrin socks. Do your own shoes, and that's fantastic. If you want to take it a step further, you could also send your clothing to Insect Shield, and they will actually treat your clothes. When they treat the clothes or the socks, it will last more than 6 weeks. It will last 70 washes. So definitely something to think about if you're at high risk, if you have an occupation or a hobby that really keeps you outside a lot and you have that high risk for tick bites. So something to think about in combination, do your shoes at home with permethrin. Can't send those away to them, so you can stay on top of that, and then you can send out some clothing. And there was actually a study, multiple studies done on this with some workers that are outside all day long, and it showed a 99% decrease chance in tick bites by using permethrin treated clothing. So it's amazing. And I really see that, I get that feedback all the time from my patients. When they really start using the permethrin on their socks and shoes, or they get an outfit for gardening or hiking or whatever it might be, that really changes things. So that's exciting. Yeah. So one more tip, and then I want to go to questions. So let me just say, please throw the questions you might have into the chat. We're going to use the Q&A. That's what we're going to do. So actually, please put them in the Q&A. I'll put a little note there for you. And then we can turn our attention to the questions. So one more tip. We talked about permethrin. We talked about cedar essential oil as a repellent. So now I also want to talk about tick tubes. So if we're thinking about your yard or immediate area of your property at home, tick tubes are incredibly effective. So the idea here is we're actually targeting the mouse population. And what the tubes are is just a tool in order to get that permethrin to the mice, because mice are the number one carrier of black-legged ticks, the white-footed mouse in the Northeast. So this makes a tremendous difference if you check this out. So I'll tell you how to do it. So you can actually do this yourself, or you can buy tick tubes. If you want to do it yourself, I have a little video on how to do that. And I did that with Lyme Project because I'm really passionate about people trying to DIY some of this themselves so you can protect yourself. It's really easy, and it's a great project. So what you do is save paper towel tubes. You can save toilet tissue tubes, although they're a little shorter, and then gather that up. Also save lint from your dryer, or if you have other materials like cotton balls or other material you think mice would like for their nests. So save those up, and then what you do is go outside again with a permethrin, get some Sawyer's 0.5%, and spray those cotton balls or lint down with the permethrin. Wear gloves, be safe, and then come back an hour or two later when it's dry, and then you stuff those tubes that you've saved with the permethrin treated cotton or lint or what have you. So this then will be placed into mouse habitat. So you think of places that mice like to be, actually these are places that ticks like to be. So like we were talking about before, darker areas, shaded areas, places where you go from grass to forest, places around like a shed or a wood pile, other debris. So yeah, if you have like a stone wall, they love that. So thinking about where mice like to be, placing those tick tubes in those areas, and then the mice will go to those tick tubes, bring that material out and bring it to their nests. And the permethrin on the material will kill the ticks that are on the mice. And this actually decreases the tick population by 93%. So this has been studied. It's pretty incredible. I also get really great feedback from patients. Year to year, we try and revisit these ideas. Hey, what else could you do to decrease those ticks and decrease those tick bites you and your kids are getting? I also get really great reviews with this. If you wanted to purchase some, you can go to ticktubes.com. You can go to thermacell.com. They also make them. Yeah, so I hope that was helpful. I hope you have some questions for me. Please put them into the Q&A and I'll be happy to answer them. I hope that you have some extra ideas now to help you not get Lyme or tick-borne disease. And please spread the word. I think when people go through Lyme, dealing with how devastating Lyme disease can be, it's hard to think about prevention, right? Because you're really thinking about, this is my treatment. I really need to get, properly diagnosed. I need to get proper treatment. You're focusing your time and your money and your effort on that. And I can't stress enough how important it is to think about the prevention as well for you and your loved ones. It's unfortunate. I see, a lot of families, the mother might acquire Lyme disease first, but then, they're all living in the same place. So maybe a daughter or son then also get a tick bite and get Lyme or babesiosis or anaplasmosis. And unfortunately, families can really be affected in that way altogether. So yeah, I hope this was helpful. Let me take a look in the Q&A. I don't know if I'm seeing any. I don't think so. No questions yet. I encourage you to ask away. It looks like with our poll about who is doing tick checks, we've got a 50%. So 50% of you are doing tick checks. So I would love to see that get to 100%. That's my challenge for you today. If nothing else, at least a tick check would be huge. That can make a big difference in early detection, right? Sometimes people find a tick crawling on them, and then, it could have attached later on, but if we can find it before it attaches, fantastic, right? If you could put your clothes in the dryer for 6 minutes after you do your tick check, that's also an added bonus, or some of the other things we talked about today. So yeah, let's get those tick checks up to 100%. That's my recommendation. All right, I'm not seeing any questions yet. So please do enter those in if you have any questions. Now in the chat, I want to also give you some links so that you can get some of these things that we've talked about. In the description of this YouTube Live, there are some links. So you can definitely, by clicking on those links, find a lot of what I've been talking about. If you go to my website, which is dralexischesney.com, you will find that you can sign up for the newsletter, and you can therefore get access to my really, really summarized take action kind of a handout that gives you all the top tips that I just talked about today, plus more, which I talk about in my book. You could also get the book. It's called Preventing Lyme and Other Tick-Borne Diseases. And that was released through Story Publishing. It was really amazing working with them. So you can find that anywhere you buy books. You can find it in an independent bookseller, Barnes and Noble, Amazon, anywhere you want to go. It's available. So it's kind of like a little guide to ticks. I go through, well, I've got it right here. I go through looking at all the ticks in North America, so the United States and Canada. And then we go through all the tick-borne diseases. We talk about which ticks carry which tick-borne diseases, because I think that's really important to know that. And then the symptoms of those tick-borne diseases, how to identify those ticks. And then we even go through basic treatment of acute tick-borne disease and diagnosis, as well as different ways to preventing Lyme and tick-borne disease. All right, let's see. Any questions? Please don't be shy. I'd love to see some questions. Let's see. Not seeing anything here. Oh, somebody has shared. I check morning and night. Awesome. Thank you, Francie. I hope that encourages others too as well. You could also put the questions in the chat. Please feel free. Oh, where can I get permethrin? Thank you. I see that. Safer New Jersey Arts Committee. Thanks for joining. You can get permethrin. Actually, it's funny. When I first was looking at places to find it, like 15 years ago, 20 years ago, I thought it would be in a hardware store, and it was hard to find. Depending on where you are, like a Tractor Supply store or a feed store. Home Depot tends to have it nowadays compared to back then. You can get it online, you find it online for sure. I use Sawyer's 0.5%, but you could, there are other brands certainly as well. And the Insect Shield that I mentioned earlier, they also sell the permethrin. So if you wanted to send some clothes or buy some clothes from them that are treated with permethrin, you could also get a bottle of permethrin from them, which is really convenient. Okay, here we go. Did I say anything about protecting dogs? Oh, I think that's a great question. There's so much to cover. So yes, I did not mention dogs, so it's a great question. Dogs, actually, let's see, there's a study showing that people who own pets have 2 times the risk of a tick bite. So this is a really important question. A lot of my patients talk about how much their dogs and cats bring in ticks. So you can actually use a little bandana or a little dog shirt or vest and actually treat that with permethrin. And that is amazing. That makes a big difference. So you can actually buy, I think, Insect Shield, yes, they have those items already treated. You can purchase from them, or you can also do it yourself every 6 weeks. I was talking about the socks and shoes that you can treat your own socks and shoes. So you can also do that with the dog bandana or vest. I also, of course, just refer people back to their veterinarians. Certainly there is that anti-tick medicine. Now there's the pill, and then there's the topical, right? So the topical is what's going to help us out. The pill is quite effective for them, but they will still bring in ticks. If the tick bites them, then it dies, and so they will not get Lyme or tick-borne disease, which is great for the dog, right? But they may be carrying in those ticks, and if they're not attaching and dying, then they're still bringing in ticks to the house. So yeah, so it's complicated, but everybody has their own decision to make around that. The other thing that people do, of course, combing your dog. Some people use like certain types of sticky stuff to try and get ticks off the dog, like a roller, yeah, so I think those covered the ideas with the animals. I mean, sometimes the tick tubes, thinking about that, if you have a yard, if it's pretty controlled, where your dog is going, then you can kind of control that environment a little bit more. And if you put the tick tubes out, then that's going to decrease the mouse population, decrease the tick population, decrease the amount of ticks they're getting. So there's also that. Okay, I hope that answered your question. Gives you some ideas. Yeah, well, I could certainly share some more tips if there aren't any other questions. We have a little more time. We can move on to another topic of prevention. So I might do another polling question though too. Let's just get a little more engagement here. If you have any feedback, I'd love to hear it. I wonder how many of you have had any experience with Lyme or tick-borne disease. Maybe that'll be our next question. So, all right. So here we'll move on to the next big tip, and I'll take a look at the chat and make sure I get to any other questions that are coming in. So another topic is thinking about what to do if you get a tick bite, right? So if you do receive a tick bite, I do talk about the different steps to go through. So I highly recommend identifying the tick. So first, of course, step one would be remove the tick. Remove the tick as soon as possible. So if you have a tick twister, that's my favorite. OTOM, the tick twister, is my favorite tool. I just see that it works so well. And they're in my tick preparedness kits. You can get them. They're actually from France, so they're not impossible to get, but they're not that readily available here either in the United States, if that's where you are as well. But they are amazing. I had somebody come in one day, actually. This was really interesting. And she was saying, you said to use the tick twister, and that's what I'm doing, and it's not coming off. She had a tick. She came right in for an appointment with the tick still on her, and I felt so terrible. So I was like, oh no, let's take a look at this. So she's showing me, and I'm like, okay, well, that's not the OTOM tick twister, but yeah, that's really too bad it's not working. So I'm like, well, let's just see if there's a difference. And so I got my OTOM out, and it came right off on the first try. So that was kind of odd, and we kind of looked at them, and we looked at the tine, So when you use a tick twister, you're, if you have your skin and you're putting the tine under the mouth parts, or between the mouth parts, and then you're twisting up. Okay, so scooting those under. If the tine is too wide, it's just going to slip right over it. So some of those tick twisters out there are like that. So that's the one she had. It just kept going right over. So the OTOM really got in there. It was a little more narrow and really gripped it. And then you could twist it right off, which is nice because then you also get the mouth parts off. So I highly recommend that. So that's step one. Step two would be apply first aid, right? So I like to use andrographis. It's a tincture. It's an herbal tincture. It has efficacy against Lyme, Borrelia, the bacteria that causes Lyme. You could use deer tick bite formula. We'll talk about that later. I created a formula to take orally after a tick bite called deer tick bite formula. So you could use either of those if you have them. If you don't, you could use rubbing alcohol, peroxide, something like that. Why I recommend that is because when the tick attaches, it releases feces onto your skin. And in the feces, if the tick has Lyme, if it's carrying any pathogens that can cause illness, the tick-borne disease. It can release those into the feces, which is really not nice to think about. I'm sorry. but so that can be sitting next to this open wound. So if you remove the tick and now you have the feces next to, these are microscopic, we're not going to see them, but they're right there next to this open wound, and people, are often touching it, looking at their tick bite, and they can drag the feces into the bite, and then you can have, another exposure, right? So I also get reports that after people use andrographis or deer tick bite formula on their tick bites, they heal quicker. They're less itchy. Sometimes for people in general, sometimes I hear how they are itchy or they're not. They're not always. They're usually not, actually. But it's interesting. I had a patient say, "Oh, my tick bites always itch, for the next 5-6 days." And this time, it was really after the first day, it just kind of cleared up and healed well and felt really good. So that was nice. So there's that bonus in addition to just using that antiseptic idea on the bite. All right, so that's step 2. So let's go to step 3. So step 3, have the tick tested for pathogens. So if you can save the tick, that would be great. Then you can identify the tick. That gives us a lot of information, because depending on the type of tick and where in the world you are when you get the tick, that gives us a lot of information regarding whether the tick might be carrying pathogens or not, and which ones. So then you know which symptoms to look for, what you need to be careful about, right? And also you can send the tick out. So if you're able to keep it, then you can actually let a professional identify it and tell you if it's carrying any pathogens or not. Because not all of the ticks are, right? I mean, I'm very passionate about educating and wanting us to be really careful and proactive, but you might get that tick report back saying, "Hey, this tick doesn't carry any pathogens." What a relief. My patients love that. So depending on where you are, I mean, the tick infection rate is different. So, in the Northeast, it's very high. Again, though, even depending where you are. So, the number one, of course, is Lyme disease. And in some areas of Vermont, the tick infection rate of black-legged ticks with Lyme is 80%. In other areas of Vermont, it's about 50%. So it's pretty high. And anaplasmosis is number 1 in Vermont. So I mention this because that's where the clinic is that I work at. But it depends. You can always look at your local information with the health department and see if they've done any research or the agricultural extension programs in your state. And they have a lot of information a lot of the time about tick infection rates. Anyhow, coming back to finding out what that tick has, that can be really, really important. So I just want to pause a moment because there is a question about products. So I probably won't be able to link every product, but if you go to my website, this is Safer New Jersey Arts Committee. Thank you for your question. You can get, if you haven't already, if you haven't gotten to my website, you can go and sign up for the newsletter. You can always unsubscribe, right? But you can get that handout, and everything that I'm mentioning today is on that handout and more. And it has active links. So that's going to be the easiest way to get all the links. If you go to my website and you don't want the newsletter and you just want to poke around, you will also find all this information. There are links. If you go to shop, that's going to be one of the major places to find a lot of these links. But that handout will be, pretty thorough. All right, so tick reports. What's next, right? So we're talking about what to do after a tick bite. So you've saved the tick, first aid on the tick bite, send the tick out to get tested. Now step 4 is begin herbal prophylaxis. So I created deer tick bite formula. It has herbs that kill Lyme and all the other pathogens that can be carried by a black-legged tick. So, I'm talking about a black-legged deer tick right now, but I've actually created formulas. I reference all this in the book. I've created a formula per tick, right? Because each tick can transmit different pathogens. So if you get, in New Jersey, we're going to be dealing with black-legged ticks, but we're also, unfortunately, going to be dealing with Lone Star ticks as well. So you may want to just keep an eye out for that, and they do look different, of course. My presentations, I've got a PowerPoint, we go through all this, but this is just sort of a quick live YouTube here. But yes, you can look on my website and find a lot of resources in that way. And so from New Jersey, you probably want to familiarize yourself with the black-legged tick and the Lone Star tick. Further up north, like Vermont, New Hampshire, and Maine, we are seeing Lone Star ticks are coming up, but I haven't had any patients with those bites yet. So it's on, that Lone Star tick is on its way up. So we do have to be careful about that and keep that in mind. Really, there's just one ingredient difference, but the black-legged deer tick bite formula is something that you can take prophylactically. So that's what I recommend as step 4. So if you're waiting for that tick report to come back, or if you didn't save it, because usually people aren't so excited to remember to save it after a tick bite, and you want to just do a month of prophylaxis, that's what I recommend, a month on that deer tick bite formula, or whatever tick bite formula it is that's appropriate. So yeah, Francis, thank you. How about Canada? Yeah, so black-legged deer ticks are the main issue up there too. In the north, are you in the Northeast, or are you out west? I can actually reference my maps. So I created maps. I really dug into looking at all the different areas and the provinces and what they were seeing. And yeah, sometimes they're like, there's no Lyme here, no ticks here. And there is more data. There's data out there. They definitely are in Canada, and you have to be careful for sure. And so just looking at the question here, Quebec. Okay, yeah. So the main issue will be the deer ticks. So black-legged deer ticks, yeah. But yeah, for anyone in other places in North America, you can reference the maps in the book. And then I have a little, in the back, I have like a table. So you can actually look up your state or province and then go across. And there's one for ticks to find out which ticks are in your state or province. And then there's another table looking at tick-borne diseases. And you look up your state or province and which tick-borne diseases are there. So it's a handy tool in case you're traveling. You could be traveling somewhere and get a tick bite somewhere else, right? So the deer tick bite formula, of course, we just need to say, I am not prescribing anything here today, right? I do not have a patient-doctor relationship with anyone here that I know of, and I am not making this recommendation specifically for you without you checking with a healthcare professional. If it seemed like it was a good fit, then the way it's taken is you take a teaspoon in water 30 minutes before breakfast, lunch, and dinner, 3 times a day, for 30 days after a tick bite. So that's that. And you can get that at Lyme Core. Again, this is on that handout that I'm referencing and on my website. So just to look at, I'll at least put my website here. I'm a little newer at doing all this. So hopefully you can go back to the description, because I did put a lot of links there so that you could see those active links. So for the deer tick bite formula, Lyme Core is the company that sells that. And how you take that is the teaspoon 3 times a day for 30 days. And while you're doing that, I would recommend watching for symptoms, right? Because it's going to be more effective if you start that deer tick bite formula earlier. So if it's 10 days or, longer after that tick bite, I can't tell you the efficacy of it. The sooner you start it, the more effective it's going to be. So having it, some people, I have, of course, I have it here, have it at home so that you can start it immediately after a tick bite. And then watch for symptoms, though. Of course, if you get any symptoms, we're thinking about fever, flu-like symptoms, new headaches, new joint or muscle pain, new joint swelling, Bell's palsy, new different kind of cognitive challenges, fatigue, of course, the rash with Lyme disease. Of course, every pathogen causes a different disease. And so we talk a lot about Lyme disease. That's the most common tick-borne disease. But there are other tick-borne diseases to watch out for. And so they each have their different kind of symptom set. So I would just, reference materials that I have available through me, or you can find out there at the Department of Health of your state or province to make sure you know which symptoms to look out for. And then if you have any of those symptoms, of course, please reach out to your healthcare provider and let them know that you had a tick bite. And if you know what kind of tick it was, tell them that. If you tested the tick and know the results from that, tell them that. Or if you're having a hard time navigating that, find a Lyme literate professional. So an incredible organization that I'm a part of is iLads. You may have heard of that, or if not, ilads.org is an excellent resource. So I'll put that in the chat. International Lyme and Associated Diseases Society. So we're a medical society. And so I'm a naturopathic doctor. There are also medical doctors, osteopathic doctors, nurse practitioners, etc., who are part of this organization. And we, create an amazing environment for learning, and have a lot of PhDs and researchers who present on newer research and clinical research. Research on testing, et cetera, et cetera. So anyhow, you can find a Lyme literate clinician through ilads.org if you need one. So let me see if there are any other questions. Please feel free to put some questions in the chat. Let's see. I also can report back here on what's going on with our poll. So I had asked, have you or someone you know had Lyme or tick-borne disease? So it looks like 60% of the people who have answered that say yes. Yeah, so usually it is that you've been affected, either yourself or someone you love, by Lyme or tick-borne disease, and that's probably what is getting you really interested in trying to prevent it. So yeah. I applaud you on that. Definitely trying to stop the spread of Lyme through prevention. I'm passionate about that. Let's just check out, do we have any other questions? I could actually just take a moment maybe to put in a few links and such so that you have it. So I'll put in the book. My book is Preventing Lyme and Other Tick-Borne Diseases through Story, which is now part of Hachette. And then the tick bite formulas. We've got your tick bite formula. You can check that out if you'd like. And then I could mention with the tick bite formula, people also like to take it prophylactically. Not after a tick bite, but during tick season. So you can take it after a tick bite, as I described already, through the steps after a tick bite. Another way to take it would be, especially if you're at high risk for ticks, like a farmer, logger, et cetera, you're a linesman, you're out there all the time. In addition to permethrin treatment of your clothes, right? That's a big one. In addition to that, I would recommend considering taking deer tick bite formula. And what we do is a half dose. So a half of a teaspoon 3 times a day. Again, please, this isn't medical advice. Please talk to your provider about it. But what I generally recommend when I do have a patient-doctor relationship with somebody would be a half of a teaspoon 3 times a day. And you can go on and off that because the half-life is not very long. So if you're out there 5 days a week and 2 days a week you're not, then you don't have to take it those 2 days a week. You could kind of do it like that. Or if you're going on a camping trip, you're going hiking, or you're intensely gardening for a period of time, you could just take it during that period of time and then stop. So that's another way that you could use that deer tick bite formula. Well, yeah, we should probably talk about, to wrap up today, I'll see if any more questions come in, but I think a good way to wrap up is with the tick preparedness kit. So I just talked about quite a few things to do after you get a tick bite. So I created this tick preparedness kit that I talk about in the book. Some people like to have that at home or in their car, so that you have all that you need if you get a tick bite, right? So I talked about that OTOM, the tick twister. It has that. It has 2 homeopathics that I actually did not mention yet today. Lidum, which you take after a tick bite, and Apis you take if you have redness, swelling, or a bullseye rash around the tick bite. If you have a bullseye rash, it's not going to cure Lyme. It will help the process initially with your immune system, but you will need proper Lyme treatment if you do find that rash. What else does it have? It has the deer tick bite formula to get you started on that. It has a little baggie so that you can save your tick and send it out to Tick Report. It has a list of the steps to take after tick bite and all the resources that you need, all right in that kit. It has the andrographis that you can put on the tick bite. So yeah, so it has all that you need to be prepared if you do get a tick bite. All right, so we've got some links up here. Yeah, I think we're going to be closing pretty shortly. So if you have any further questions, get them in the chat. Now's your chance. I'd be really happy to say, or if you want to share something, if you want to share something with others about your experience, what works for you, what have you tried, what has worked for preventing tick bites, what has not worked for preventing tick bites. I'm happy to hear that as well, and for people to share with others. Sounds like, Francis, you take Lidum too. Yep, Ledum, you got it. And you bought a homeopathic nosode. Yeah, I've actually had some experience with that as well, and people using that with their animals. Interesting. Thank you for sharing. All right. Well, I think we're probably going to be closing up if everybody feels good about the questions. I'll just put my website again in case you need that. I do see people remotely at my private office. I work through a clinic full-time in Vermont, and then I have a private practice, and I work with people all over the world from my private practice. So it's all telemedicine. And so depending on the state you're in, if you're in Vermont or New Hampshire, I have full prescribing rights for pharmaceuticals. I also use, of course, a lot of natural remedies. And then if you're in a state I don't have a license, or around the world, I consult with you. So I'm happy to work with people who already have an MD or somebody who does have the ability to take care of them in the way of their primary care, and if they needed antibiotics, and then I can consult with people in that way on Lyme and tick-borne disease. So yeah, so you can check out my website. There are a lot of good resources there. There's some other interviews when I had the pandemic virtual book tour. So I hope that you found this helpful. I hope that you can get inspired to do maybe one new thing this year, plan one new thing to try and prevent tick bites. I think just, a little bit at a time, we can really make a difference in our lives and sharing with others so that we can end this epidemic of Lyme and tick-borne disease through prevention. Thank you so much for coming. I hope you have a wonderful rest of your Sunday. Take care.